My name is Ekta and I go to, I have to think about that. So I study podiatry at the University of Northampton. And here are some things that you need to know and that I think is essential for you to know before you join any AHP field. So first you need to do your research. If you're entering a field like podiatry, what is it? And some kind of heads up that will help you. So a brilliant heads up that I got from a very young age was that podiatry, you're working with feet. So if you've got any kind of skittishness when it comes to feet, this ain't the career for you. Let's just put that out there. But there's a lot of like biomechanics involved, so you can do a lot of sports medicine with podiatry. It's kind of a gateway onto other fields, let's say, or other careers. So if you study podiatry, you can specialize in sports medication, sports medicine. So you're working with a lot of athletes, you're working with rehab therapy, so a lot of exercises. And you can also specialize with diabetes, so you can specialize in wound care, which means a lot of ulcers. You're helping a lot of people essentially with any kind of pain that they have in their lower limb. You're helping them with their foot and ankle pain, knee pain, and it's all kind of it stems from your feet and it kind of goes upwards. So I feel like if you have any kind of interest in a healthcare profession and you want to help people feel less pain or feel less discomfort when they're walking, then this is definitely the field for you, because how awful is it when you've had a foot injury or there's something like uncomfortable in your foot or even like in your shoe and you're like, okay, well, this is horrible. Like imagine having to deal with that and not being able to get rid of that little stone in your shoe for long periods of time. So there are patients who sometimes, like especially diabetic patients where they have neuropathy, they can't really feel that small stone in their foot and that builds up. And you're essentially helping them, find that little stone in the foot or in the shoe. What other things that you need to know about podiatry? Well, for Northampton, I don't know about a lot of other universities that offer podiatry as their course, but for Northampton, we got to, in our first year especially, we got to learn a lot about the anatomy through dissections. So we went to the University of Leicester where we did dissections, and they kind of like went through the entire lower limb, so hip downwards. And you got to kind of peel back the layers. As morbid as that sounds, you got to peel back the layers, you got to see what muscle does what, and you could actually pull on a muscle, and you can, if it's an extension, you could see the muscle extending. It's really, really cool. It's really hands-on. So if you're the kind of person that learns really well with hands-on material, podiatry is definitely the course for you. And forget podiatry, even any kind of allied healthcare profession, they tend to be very hands-on, and you get to work with people immediately. So if you think you want to develop your people skills, or if you have great people skills already and you want to work on that, that's another option to consider, like podiatry. You get to work with patients, you get to work with people that have genuine problems. And I know there's a big stigma with, podiatrists only do toenail clippings. Yes, we do toenail clippings. We debride a lot of corns, calluses, anything that kind of causes any pain and discomfort for people in their feet, we tend to kind of debride and get rid of. But it's not restricted to toenail clippings. There's a lot of biomechanics involved and learning, okay, you need to know your anatomy for that, to be able to help alleviate some kind of pain that isn't visible, but it's a muscle pain. You can't really see it. So plantar fasciitis is another good thing. If you're interested in that, please go check it out. I think it's a super cool thing to have wrong with you, because we kind of don't really know where it all comes from, and there's different diagnoses for that. So I think that's really, really cool. If you're interested, please go check it out. What courses do you need for podiatry? I think the essential sciences. You really need your biochem, physics. Physics is a big one because we use a lot of force when it comes to our gait cycle and learning how force impacts the rest of it. And I'm not going to give away too many spoilers, but I think that is incredibly, incredibly important. Again, English as a basics, you need to learn how to communicate with people. You need to learn how to pick up on their psychological cues. Some people use words as an emotional response, or that will be kind of emotionally reactive, and you need to learn how to pick up on that. And I think that is a really great tip. What other things? So my personal experience with podiatry is I'm really enjoying it so far. I'm in my second year. There's something that's worked. I'm sticking around for it. I transitioned from law. So it's completely like from one side to the other. I didn't find much satisfaction in law. I feel like it really wasn't going to be making much of a difference. But with podiatry, because in first year you get to see patients as well, very minimal work they'll get you to do, not too much, because again, you need tutor supervision, but they get you to do the small things. And I think I started realizing that this was the right choice for me career-wise, because in my first year, I could see I was making a difference. Even if it was toenail clippings in the first year. It's very basic stuff, basic foot care routine that you get to do. But I realized I was able to help somebody that couldn't exactly clip their toenails. It was very difficult, almost impossible for them to clip their toenails. And I, being their kind of clinician for the day, or clinician in the making for the day, I got to help them do something they are physically restricted to do. And that gives you bear with me, that gives you a bit of an ego boost, I'm not gonna lie, but you do get to see in the first year, you get to make a genuine change in people's lives. So I think that's, again, a really amazing feeling. It's a very satisfying profession. Even as a student, it is incredibly satisfying, because in the second year, you do get to get a bit more hands-on with the patients. You get to see more orthopedic patients and more diabetic patients. And it's just the amount of change that we're going to be making is like mind-blowing. So if you pick that, these are the things that you're looking for in a career, is satisfaction, first of all. Secondly, helping people in a way that they are physically restricted to, that they can't really help themselves in that way, then podiatry is definitely the career for you. And I think you'd be making the right choice if you pick podiatry, and I think you'd be making an even better choice if you pick Northampton. So I hope you enjoy the rest of your day, and please stay safe and do take care of yourselves, especially take care of your feet. Bye.
So hello everybody, welcome back. We just have Mr. Paul Fletcher here with us today, and he's going to talk about his route into the industry and what interested him in going from this industry and rather than going into medicine. Over to you, Paul.
Yeah, thanks. I think I wanted to do medicine when I was at school. There were a few things. I was really good at science, so I wanted to use my science practically and do something that was helping people, really. There were opportunities for dentistry, and I think dentistry was very cosmetic, really. It was just about the looks and those kind of things. But I wanted to, actually do something physical that would make somebody better. And a careers advisor said, "Have you thought about podiatry?" And when I looked into it, it was just the thing for me. It was really very practical. You got to be in charge of the patient, so you got to diagnose them and treat them, and see the patient journey right through from beginning to end. So you weren't just a part of it, you were directing it and managing it, really. So that was what really appealed to me, I think.
Okay, I think someone's talking about the fact that in the UK you go straight into podiatry, and in America it's a kind of different process. Do you know much about that?
Yeah, definitely. In the UK, it's a little bit like dentistry, and you become a specialist from the beginning. So the students are learning lower limb assessment techniques. I've been in clinic doing things with them, blood pressures and those kind of things. So in America, it's a very different model. So you become a doctor first, and then you become a podiatrist. But here you specialize straight away. So when you finished at the end of 3 years, you know more about feet than general practitioners here, really. So you're a specialist from the beginning. And if you want to carry on and do postgraduate stuff, you can go into the surgical side or maybe into the sports side. There's lots of different things. Once you're into it, you can make it your own, really. So that's the good thing.
So I wanted to be in the football space when I was younger. So I'm sure they take on a lot of podiatrists in the the football and all those sports kind of industries as well.
Absolutely. Once they find out that as a podiatrist you can make people run faster and get fatigued less and have less injuries, football teams are really interested in that. So all Premier League football teams have a podiatrist on board for just those reasons, really. So if you like that kind of thing, obviously they're premium jobs, so you've got to be good to get into them, but somebody's got to do it. So yeah, definitely.
I personally don't think I could work with feet, Paul, if I'm honest. I don't know how everyone's feet and tell us about how you maybe got over that fear, or if there's, if it's not as bad as I think it may be.
I don't think it's that bad. I mean, if you think about medicine, you're going to be working with a lot of areas of the body that are a lot more uncomfortable to deal with than feet. Certainly, I think they were talking about turtles breathing through the bottom earlier, I think. And, there are those kind of areas that as a podiatrist, I'm glad that I deal with feet. So, and it's pretty good. And once you've focused on what you're actually doing, you forget about those squeamish things. It's a bit like overcoming a tickle, really. I was kind of worried that I might be scared if there was a foot hanging off. But when you actually know what you're doing, you know how to make it better, and you understand the anatomy, all of a sudden you're not really bothered about that anymore, and you settle down. And I was worried. But
I'm immune to the smelly feet situation as well, I'm sure.
Most of them aren't too bad. I know there are some smelly feet out there, but to be honest, you prepare the feet first, so you sort of give them a bit of a hosing down with antiseptic and things. So by the time, and often you might have an assistant who's preparing feet for you as well. So a lot of the time you're not really faced with those really terrible things, but occasionally. And obviously people need them making better, so you're focused on actually making a difference to somebody and those kind of things.
Thank you so much, Paul. I really enjoyed this session. If we have any questions, we can get in contact with the department, and I'm sure there's going to be resources online. Thank you so much for participating, and we'll see you soon.
Absolutely, that's great. Thanks for having me on anyway, and good luck to anyone who's thinking of doing this. It's a real fun thing to do.
Thank you.